Good evening, everybody, and welcome to this Bluetongue update brought to you on behalf of the whole industry, but facilitated by AHDB. My name's Mike Gooding. I'm Farming Systems Director at AHDB. And joining me this evening are Gordon Hickman, who is Head of Exotic Disease Control at DEFRA, and Clara Saville, Veterinary Head of Exotic Diseases at the APHA. What we will do is, as we've done in our formal webinars, we will hear from Gordon, who will give us an update, and we'll then have an extended Q&A session. I should say that the webinar is being recorded from now on, and it will be available for anybody to view with access through the website within the next 24 hours. Please keep your eye on the website, particularly the AHDB website, which has lots of links to the other areas of information. And if you would like to enter a question in the now familiar format for everybody, there is a questions box. It should be towards the top right-hand side of your screen. Please do type in your questions. My colleague Steve is working away in the background, and we'll filter them through to me, and we'll try and make sure we will cover all areas. At the end of the webinar, there will be, of course, the obligatory feedback form. That's really helpful to us if you feel that there are areas that haven't been covered in the webinar that you'd like to hear more about. Thank you. Next slide, please. If I can draw your attention to some key areas of information, the Ruminant Health and Welfare website is really the center of all industry information, and that QR code that's on the screen, if you use QR codes, should take you straight there. The AHDB Bluetongue hotline, which is also behind me on the image, 024 7771 0386. That's manned during office hours. If you leave a message outside office hours, the team are very good at getting back to you. So if there are further questions and you'd like to speak to somebody, do give the hotline a call. Lots of information on the government website about Bluetongue and how to spot it. Plenty of information on the AHDB website, as I said. And if, like me, you want to get the alerts about particularly things like how the restriction zones move, the APHA disease alert, I would thoroughly recommend that on your phone, and that pings you an update as soon as there is information out there. Thank you. Next slide, please. That is the APHA disease alert. That QR code will take you through to receiving those alerts on your phone. Thank you. Next slide, please, Anna. I want to also draw your attention to this industry-wide survey. This has been running for a few weeks now. It's supported by all of those organisations that you can see at the top. It's an anonymous survey, although you can enter your name into it if you want to have some response. It's really useful because it's helping the industry understand how what is happening across the whole country, not just in those areas where there are recognised challenges. The more data, the more information that goes into the survey, the more that helps us as an industry understand exactly what's going on. Many farmers have taken part in that survey, and I would encourage anybody to do so. As I said, it's anonymous. You're not going to get pulled up on anything. But if you've seen any clinical signs or you're just suspicious, it's really useful to hear from you. Thank you very much, Anna. We'll come to that at the end of the end of our presentation, and I'll remind you about some of the other areas where we know that these are particularly challenging times, but you can get help if you need it. So, look, I'd like to go straight over to Gordon Hickman. Gordon, as I said, is Head of Exotic Disease Control at DEFRA. Gordon's been a regular contributor to these update webinars. So, Gordon, over to you for your latest situation.
Thank you, Mike, and thanks for inviting me back. So over the next sort of 15 minutes or so, I'm just going to give you an update on where we're at, the changes that have happened since we last met, the current disease situation, and a little bit about progress with vaccination, etc. Really just to set things up for a wider discussion afterwards. Next slide, please. So the latest situation, you all know that we first got that detection on the 26th of August. We believe that there was an initial incursion into Norfolk and East Yorkshire, and then likely either around about the same time or shortly afterwards, probably in Kent and almost certainly along the south coast as well. So as of today, we have 163 premises in England where there's one or more confirmed Bluetongue positive animal, and there's 2 in Wales. I need to stress that there is no circulation of virus in Wales. Both of those cases were where animals moved from England, from what is now the restricted zone, into Wales, but before the zones were put in place. So that means 165 in total. Of those, there are 14 of them that are not currently in the zone, or not in the current zone, probably I should put it that way. And all of these, like the 2 in Wales, and it includes those 2, were identified through the tracing of animals where disease is now known to be circulating. So for those cases where we believe that infection moved with the animal as opposed to became infected in situ, we don't extend the zone to include them, and we don't put in place temporary control zones, but we do surveillance in and around those premises to check that there hasn't been local transmission. I mentioned the zone, the restricted zone. Technically, it's also an infected area. And that was last extended over the weekend on the 16th of November. That last extension took it to cover a bit more of Hampshire and a small corner of Wiltshire. And that was extended because we found through a clinical report case in what we call the free area, so just into the clean area, if you like, of England. And so because that was local transmission, fresh infection, we extended the zone. And our policy is to try and keep the zone 20 kilometres ahead of known infection. You know this, but vaccination using a permitted unauthorised vaccine is allowed in England, and those vaccines are readily available through your private vets. This it's worth saying that we're now in we're calling it a low transmission period. There are still active midges. We're hoping that this cold snap will help kill off some of those midges, but we do need a prolonged cold snap in order to kill off midges. They will be reduced, but they are still active. And an infected midge, as you know from talks by Chris Sanders and Marion England, they are infected for life. So if they're active and infected, and they bite one of your animals, they will go down with disease. But what it does mean is that an infected animal, if it's bitten by an uninfected midge, it's very, very unlikely that that virus will be able to replicate in the midge over the coming weeks, and so there won't be onward transmission. And that's important because it means that we've been able to ease some of the restrictions, which I'll talk about in a minute. but I must stress we are not in the seasonal vector low period. Next slide, please. So really just to put it into context, so that's where that little pink line, hopefully you can see that, that's superimposed on cattle density. And I think it's important to stress that, you know, one of the reasons why we've been so keen to manage this disease and to slow the spread is because we knew that we were going to get the incursion into the east coast and probably along the south coast. And of course, whilst it's been hugely impactful on farmers in the zone, when you look at where most of our susceptible livestock are, they're in the west and in the north and in Wales and Scotland. So although the zone covers 24% of the GB area, only 11% of the susceptible livestock are in that zone. And we think that may have part of the reason why we're not seeing quite the level of clinical disease that we're seeing in the Netherlands and Germany in very high dense livestock areas. It's not all the reason, but it may be part of the reason. So that's why we've been trying to keep it out of those areas for as long as possible till we get this cold snap, till we get new vaccines or the same vaccines but are fully authorized. And it's 10% of the breeding sheep population, 10%, 12% of the cattle population. Next slide. And this is the same. No, sorry, back one. I think it's even more marked if you look at the sheep density maps. And obviously sheep are the animals that are showing the most severe clinical signs and the highest levels of mortalities. So I thought it was worth just showing those density maps and superimposing the zones. But we do recognise that it is impactful, and particularly those farmers and keepers either side of the zone. So if you're trading into the zone, or you've got land in the zone and you normally trade out of the zone, we do recognize that that's more impactful than perhaps if you can do all of your business in the county. Next slide. So that's the zone again as per the interactive map, and you can zoom in on the website if you want to see exactly whether you're in or not. The border, where possible, is drawn around district or county boundaries, but you'll note for the last couple of extensions, the areas have been in what we call unitary authorities, where there are no districts. So I've actually used roads as the boundary for them to try and minimize the size of those zones. There've been a couple of changes in license moves that I just want to remind you about or draw to your attention. So firstly, dedicated slaughter markets. I think I mentioned them last time. They were fairly new then. So there are a number of approved dedicated slaughter markets or red marts, both inside and outside the zone. And you can sell through those slaughter marts, provided they're approved, and there is a new general license that allows you to move to those slaughter marts and onwards to a designated abattoir. They do have to go to a designated abattoir, but that aspect will be managed by the slaughter mart. We've also last Friday, and I think this is more significant for more people, so that general license now has been amended. So it's no longer a requirement for animals to arrive at the designated abattoir or slaughterhouse between the hours of 1 hour after dawn and 2 hours before dusk. That's sunrise and sunset. Up until last Friday, you had to deliver during daylight hours, and those animals also had to be killed during those daylight hours. Because we're now in this low transmission period, we've been able to ease those restrictions. So those animals can arrive at any time that the abattoir will receive them. Still has to be a designated abattoir, but importantly, those animals can now stay in the lairage overnight, and as long as those animals are killed within 24 hours. So that should be much less impactful on the abattoir operators, and we're hoping that that should remove any of this issue over differential pricing that potentially has been seen in some areas. We've also fairly recently introduced a general license that will allow approved breeding sales. I do accept that most of the breeding sales are finished now, but you can have breeding sales now, and those marts can be either inside or outside of the zone. I think there's a couple of approved marts now that can have those sales. There's a couple of general licenses. I think the important to say is that if you are selling through one of those breeding markets, you will still need to have a pre-movement test and a post-movement test. So if you are selling through those, organise that pre-movement test, because the auctioneer will need to see evidence of that pre-movement test in order to allow them to be sold through the mart. And just a reminder, because we do get asked this, there is no license or testing requirement for moves fully within the RZ, including sales through markets, as long as those animals never leave the zone. So any markets in the zone can buy and sell as long as they stay within that pink area. While I've got this slide up, I might, whoops, sorry, back one. Whilst I'm still there, just a reminder that we are continuing to do surveillance along the border. So along that top line in North Yorkshire and all the way down the edge and along that Hampshire border. And we're doing that to reassure ourselves that we don't have disease that's less than 20 kilometres away from the border. We've had a few questions in the past around, well, you're only testing 35 cattle there, but you've made me bring all my sheep and things in. Well, we've listened to that. Whilst we still want to look at your movement records and your medicine record, we're no longer requiring all those animals to be inspected. So we still want to take the bloods from those 35 cattle. We still want to look at the movement records and the things, but there's no longer requirement to bring all your sheep in off the hills or off the marshes, etc., to be inspected. Next slide, please. So a little bit about vaccination. So as you know, we've permitted the use of 3 vaccines. They're the 3 vaccines that are also available in continental Europe. Not all countries have permitted all of them, but we have. Remember, this is only in England, although if you look on the website, you'll see that they are permitted anywhere in the UK. You still need a license to use them. When we started off on this journey, we had a general license for the high risk counties, and then you had to apply for a specific license in everywhere else in England. And we did that to try and just keep a handle on supply and demand. We're comfortable now that there's more than enough supply to meet demand. So a few weeks ago, actually on the 18th of October, I can see the license there. We changed it so that everywhere in England that general license could be taken advantage of. So just a reminder, you do need to speak to your private vet, and maybe Clara can talk a little bit about that later on, about what you should be considering about that. But if you do want to vaccinate and you discuss this with your private vet, there must be a written prescription from your vet. The vaccine must be supplied by the vet, and we'll ask your private vet just to send some information on that prescription, just so that we can monitor that. We also allow farmers to administer the vaccine themselves, provided it's been prescribed by the vet. But you are required under the license to fill in a form to let us know which animals have been vaccinated. That's all online, and we monitor that. And I'm going to show you the latest data from that on the next slide. And just a reminder, and particularly for any camelid owners that may be listening, they do need to be permanently marked with an official ID. So that will mean that camelid owners do need to register their herds and to get an official ID mark. Next slide. I think I've got a couple more slides just with a little bit more on vaccines. So as expected, because it is relatively late in the year and the clinical signs have yet been haven't been that dramatic. There have been deaths, there have been some pretty significant clinical signs, particularly in some sheep, but take-up's been modest, but pretty much as we expected. So of the animals vaccinated so far, 63% are sheep, 33% are cattle, 2% camelids, 2% goats, and there's one reindeer being vaccinated. As you would expect, most of the vaccination that's gone on has been in the east of the country, and almost all of it has been in the zone, but not all. We have had people in Staffordshire that are vaccinated, for example. We suspect that most of them are pedigree animals or high value animals, or smaller hobby farms. Worth putting them into context that less than 0.5% of susceptible species in England have been vaccinated to date. And next slide, which I think is in my last slide with things on it. So these are just the numbers. So just over 12.5, well, just under 12,500 in total. And that's how you can see the take up has been over time. It's still going up. I think it's probably flatlined, as I would expect as we come to the end of the season. And I would imagine most people will think about it next spring, going forward, because we're in a much lower risk period, but it's still absolutely not no risk. So I think my last slide is probably just any questions, but thank you for that. Hopefully that was a useful update.
Gordon, thank you very much. That is really useful. And I have to say, as a farmer in Oxfordshire, I've never been so pleased to see snow in November as we did just yesterday. Is that me just being an optimistic farmer? Or do you genuinely feel now that this cold snap that we have had, is it enough? I mean, one of the questions is, how long do you mean a prolonged cold snap? How many days do we need to really suppress midge activity? Clara, I don't know if you can answer that, or Gordon. Who's the
Well,
midge?
we actually asked Marion England that this afternoon at our core group meeting, and she said, unfortunately, it's unlikely to be long enough. It will impact it. I think we're talking a couple of weeks really in reality to have those really low temperatures, and they do need to get really quite low. That we talk about 15 degrees, but that's about the virus replicating in the midge, and so that's now past, and that's why we're now in this low transmission period. But it's got to get down into the sort of the 4 degrees for several days, I think. And unfortunately, for another purpose, I was on a call with the Met Office today, and they delightfully told me it was going to get warmer at the weekend. So it will absolutely help, and anything that we can do to any reduction would definitely help. And if they're less active, and it's darker as well, it'll certainly help. And I
Just to
think we
remind
have
every
seen so we have seen a reduction in number of cases as well. So it's not just the fact that we've had this cold snap; it is cooler overall, and we are seeing fewer cases. I mean, we're still seeing clinical cases. We're still 3 or 4 or 5 clinical cases a week. So infected midges are still out there and still biting and still causing disease.
Okay, so look, perhaps we'll come back to that. And Clara, just before I come to you to talk a bit more about vaccinations, Gordon, can I just do a point of clarity for something you said, I think you said, which was infected animals that are bitten by a non-infected midge are unlikely to contract the disease. Did I get that right?
Oh,
And is that a change in our understanding?
no, sorry. If I said that, I got it wrong. Um, if an uninfected midge bites an infected animal,
Yes.
that midge won't be able to replicate the disease and won't be able to go on and bite another naive animal and infect it. Um, so you don't get onward transmission from an infected animal. And
Right.
that's why we've stopped culling animals outside of the zone where we trace them, because they are no longer going to be a risk to the population. They might have been a risk 2 weeks ago, a month ago, but they're no longer a risk from today. So that's why we've stopped culling those animals that we find outside of the zone.
Okay, that's great, Gordon. Thank you. Clara, can we talk a bit more about vaccination and vaccination strategies? Perhaps, what I might be thinking about on my farm with my animals. If we breathe a little bit of a sigh of relief, I turn my attention to thinking about, March, April, May next year. What ought to be going through my mind?
Thanks, Mike. And it's a pleasure to be here with all of you. So as Gordon has said, we worked with the Veterinary Medicines Directorate to ensure that the vaccines were available under an emergency licence, so that they're now available through your vets. We've had over 12,000 animals have been vaccinated, but vaccination isn't mandatory. Some countries in Europe are talking about making vaccination mandatory. That's not something that we're doing. And the vaccine isn't subsidised by the government, that's funded by farmers. So a consideration is thinking about how much that might cost and figuring that out. The British Veterinary Association have put together a really helpful table for vets, but I think it's really helpful for farmers to look at as well. This information is really helpful for you. And so that compares those 3 vaccines that are available. As the government, we can't promote one vaccine over the other. But for all of the vaccines, so none of them are fully protective. So they won't completely stop infection. But what they have been shown to do on the continent is really reduce clinical signs and really reduce the mortality in places like the Netherlands, where they've had far higher mortality than us. So that is what these vaccines are going to do. Then they're not going to it doesn't change the movement restrictions that are in place, whether animals are vaccinated or not. They're treated the same in terms of the government restrictions. And ideally, talk this through with your vet and weigh up the considerations, because there are things to think about in terms of, so it's been shown to be safe to use in pregnant animals, but not in breeding bulls. And there are, when you're vaccinating very young animals that may have been born from a vaccinated dam or a recently infected dam, there are antibodies that might be in the system that might interfere with the vaccine efficacy. So you want to think about timing and talk that through with your vet.
So, Clara, can I just pick up on that, because that's my favourite question in these webinars? If there is no benefit in me vaccinating my pregnant ewes ahead of lambing, in the hope that there's some protection passing through the placenta to the lamb.
So because they haven't gone through a market authorization process, there's less information than we would normally have for a vaccine. But there will likely, from what we know about other vaccines, there will be some protection going to the lambs through colostrum. But it's just when you're thinking about vaccinating those lambs once they have been born to a vaccinated ewe. You've just got to look at the timings of that. This is all laid out in the BVA table. I believe it's sort of 3 months after birth. There might still be some residual antibodies that would then mean that the vaccine doesn't work effectively if you were to vaccinate that lamb.
Okay, interesting. So
planning ahead.
It's definitely one to discuss with your vet. You talked about a BVA table. Us mere mortals who are not members of the BVA, we should be able to access that, should we?
Yes, I'll try and find the link and send it to you so that you can circulate.
That sounds really useful. I will make sure that link goes up on the website for people. One of the questions that's come in about the vaccines, Clara, you might be able to comment about this. Should vets be able to obtain any of the 3 vaccines? When I asked a vet a few weeks ago, some were only supplying one of the vaccines. Is there a restriction, or is that just a commercial decision that the veterinary practice is making?
Yes, I think that's a commercial decision. We've also had those conversations with stakeholders, and that's the feedback that we have had. All 3 should be available, but vets are making commercial decisions about what they're stocking. And so that is out of our hands and up to the vets.
And Clara, perhaps looking further ahead in terms of registration of the vaccines in the future, is there any progress to report? Is there anything likely to happen that we should be looking out for?
So when submissions are made to the Veterinary Medicines Directorate for a market authorization, that's commercially sensitive information. So even us at APHA and DEFRA won't know that information until there is market authorization from the Veterinary Medicines Directorate.
But really, this is about commercial vaccine company decision making rather than anything about biology or veterinary considerations.
Yes, and their sort of understanding of the market, and I believe the companies are doing their own market research to figure that out. And another element of us all helping with the decision making is, as you said, the surveys that are the Nottingham survey and the survey that's being conducted by making contact with those farmers with report cases. That's all helping us to gather information. We're all still building a picture of what's happening with this virus, and so that information is valuable to us all because it can help then with your decision making about whether to vaccinate or not based on the results of those surveys.
So, Clara, without responding to the next question by saying you should speak to your vet, vaccination for a large flock can be very expensive. Yeah. Is there any tactical vaccination that can be done for more susceptible animals? As I say, we're still learning about this virus and don't really have an understanding of exactly. There's anecdotal reports of some breeds being more susceptible than others, and so, but we don't have a full picture yet. But ask your vet and talk to your vet.
Gordon, you may have further insight on that in terms of tactical vaccination.
I don't think so. I think there's also something around, the practicalities of vaccination as well. In terms of where those animals are going to end up in the summer, because the highest risk will be in the summer periods. Whether it's blown across from continental Europe again, or we get overwintering, if those animals are going to be out and you won't have access to them, you might want to think about vaccinating them earlier, but because they may be more exposed. But there really isn't that evidence that we can say breed X is more resistant than others. I think we hear anecdotal evidence that things like Texels are most likely, and perhaps some of the Wiltshires, Wiltshire Horns certainly do appear to be more susceptible than others. But everything's ultimately susceptible.
Question about vaccine supply. Actually, are we expecting any shortages of vaccine? I'm undecided whether to vaccinate or not, but worried that there may be not enough if there's a big outbreak in the spring. Any comments about the amount of vaccine stock or potentially availability next year?
Certainly start planning ahead.
Yeah,
yes.
I mean, definitely start planning. I think if you're very likely to want to go down that route, put that expression in with your private vet, because this is all about commercial reality. If the pharmaceutical companies see that the Netherlands is a much bigger market, or Germany, or we know that Belgium have mandated the use of vaccine at farmers' expense, mind. So that's a guaranteed market. If we aren't a guaranteed market, they'll shift it. I mean, I don't suppose they'll pull stock from here, but it's possible. So I think it's about just making sure that people are aware of likely demand.
Okay, so look, one more technical question around vaccines, and then perhaps we'll move on to some other bits. I'm a sheep farmer in Somerset, and I'm thinking about vaccinating using the Cyvalzal, is it TBV vaccine? My research shows that the safety of this vaccine has not been established in breeding males, and you mentioned males earlier on, Clara.
Yeah.
Can anyone give me advice on vaccinating or not my rams?
I would probably avoid it, certainly when he's needed for tupping, because safety hasn't been established. I assume from that it's impacting semen production at the point of vaccination. You get a spike in temperature, and that could have an impact. I'm assuming that that's what that means. Again, once one or all of these vaccines have gone through the really thorough market authorization process, more data is available on that.
Is that time between perhaps getting a temperature spike as a result of the vaccination and sperm production, does that vary? Is that different between sheep and cattle? So is the sort of period where you're unlikely to have effect on the fertility different between the species?
Yes, it will be. Off the top of my head, I cannot remember exactly the time it's taking, but you want to leave it at least 8 weeks.
Yeah,
I would say
I
for
some
considering
reason
that.
50 days or something is in my head for bull semen production, but clearly I'm not a vet. So, Gordon, I don't know if you've dashed off or you're still there, but there's one here about, are we likely to be in a position where we can import dairy heifers from Germany again? What sort of thoughts are there around the movement of stock into the country?
So I think in the short term, until we have authorized vaccines with a guaranteed period of immunity, the answer is no. In the same way as we can't export anything either, the other way. So that's why the development of these authorized vaccines are so important, and it's the guaranteed period of immunity that's the critical bit. And because they haven't done that trial work yet, or maybe they will be soon having. We should at least have 6 months worth of data now coming forward. So 6 months would be long enough for a guaranteed period of immunity if they've got that dossier of information, and that would mean that we could allow that. There's talk about looking at vector proof establishments, but we haven't got any of them, and I think we'd need one on both sides. So you'd need a vector proof establishment in Germany and one here. So I think that's quite a long way off as well.
Just a couple of questions really about some of the variations. Are more rams contracting Bluetongue than ewes and wethers? Are we seeing any difference between the sexes from all the data that you've got now?
I think this is where we certainly need the Nottingham survey, and we need our own survey for that. I mean, just remember, we're not testing every animal, even on an infected premises. Certainly, I think early days there was a disproportionate number of rams that were reported, but is that because they're more susceptible, or that they were in ram groups, they were being looked at every day, and they were being looked after and mollycoddled pre-tupping, and so they were spotted, and the ewes were out on the marsh somewhere or in a field somewhere, so weren't spotted. So we genuinely don't know whether that is the case or not. But I don't know, Clara, if we haven't got any statistical evidence.
Yes, I was trying to look to see if I've got that information easily available, but unfortunately not. But certainly those first few cases that we were getting through, there were so many rams, but for the reason Gordon said, we can't assume any statistical significance from that, because we know that from our report cases, we're only picking up 20% of infected animals, or only 20% will be 20 to 30% will be showing clinical signs. So there's we're getting the tip of the iceberg, and there's a whole iceberg that we're not seeing, and that makes it really difficult to draw conclusions.
One of the questions is around, have we got any update on the results of the various surveys and things, or are we early days? Is there anything to report that's coming out of the surveys? I'll take that silence as a no, shall I? Is it's a genuine request from as many people as possible to send data in. What's the timelines, Gordon?
So I think there's been an initial release of information last week, I think. I don't think there's a lot of statistical information released yet, because I think still relatively few infected premises, if I can use that term, people that have had clinically affected animals have responded yet. We probably won't have our results for another couple of weeks yet, with any sort of significant numbers in them. So
okay, but maybe but towards Christmas or early in the new year, you would expect to have some analyses.
Yeah, we would absolutely expect to have some analysis. I think it's worth stressing that that will show what we know. So that'll be the clinical signs that we've seen. What we won't know is that the bit under the water, what fertility impacts there will have been from those. We've spoken about the temperature, the pyrexia that animals get, and that can affect fertility. And we do know some bulls have been tested and they've almost been zero fertile because of that fever at the wrong time, if you like. So we just genuinely don't know if there's going to be extended calving intervals, increased abortions, for example, increased stillbirths, and even perhaps lower lambing percentages. So we'll really only know that next spring, when some of that cycle comes through, which is why one of the reasons we're being pretty precautionary about this, because we don't know.
And that will be really interesting information to submit in the survey, that impact on fertility and lambing next year. I think that will help us all really understand. And the DEFRA-led survey involves phoning anyone who has had a report case, a positive case. And so a plea, those that have been through this and have been unfortunate enough to have a positive report case, your experience will be so valuable and will help other farmers. And so if DEFRA is phoning you up, please take the time to respond and share your information. That would be so helpful.
Clara, you mentioned mortality earlier on in the few comments that you made. And, in previous meetings, we've discussed the severity or the amount of mortality that's seen on the continent, which has been quite dramatic. But there also seems to be quite a lot of variation. There's been severe outbreaks, but low mortality. And there's been less severe outbreaks, but very high levels of mortality. 50%, I think, is what we talked about in some cases. Is there any indication about what is causing those variations and what we might expect to see, if we get a severe outbreak next year in the UK?
This is something that we have been thinking about a lot. Why does it look so different on the continent compared to, thankfully here, relatively low mortality, low impact of clinical signs? And Gordon and I actually met with the NFU equivalent from the Netherlands a few weeks ago, and we were discussing that. So as Gordon said, it could be the density of livestock. Is just the density of livestock in the Netherlands is so much greater. You're just generating a greater infectious load. There are more infected midges. There's just so much more virus going around. Of course, they have slightly different breeds of animals to us and different management practices. And of course, in our situation, it would have just started off with a few midges being blown across the channel. And so that infectious burden was a lot less and went into those areas with very low livestock density. But that's not to say that next year we might not end up in the same situation as has happened in the continent. So for their first year, it wasn't quite so bad. And then the second season, it was much worse. But Bluetongue virus surprises us continuously. It's really, really variable. So let's keep everything crossed that we don't end up with the same situation as they did on the continent next year. But let's prepare for the worst, I think. Unfortunately, I don't have a crystal ball.
I think there's also the potential for, I don't know what the word is, comorbidity. If an animal is already suffering from worms or some other illness and they get Bluetongue, then that will almost certainly lead to increased mortality. And we do know that certainly in the Netherlands, there was some evidence of that. And so they think that's a contributory factor. So, the healthier your animal, the more likely it is to also pull through. And I think that 50%, we've got to be a little bit careful. I think that's sort of case fatality. So if an animal is infected, then it's more likely to die. But that's not to say that 50% of a flock will die, because a relatively small proportion of that flock will get infected. So we just got to be a little bit careful using those sorts of things. I mean, we do know that the Netherlands lost 5% of their sheep population. So, and that is significant. Obviously, smaller numbers of dairy of cattle, about 2%. But the Belgians also, have lost 30-odd thousand animals. And they have a really good surveillance system where they have a baseline of all mortality, so they can accurately assess excess deaths. And just the only other thing is, if it strikes earlier, so if you get overwintering like it did in the Netherlands, it kicked off in July, whereas ours kicked off at the end of August. So you've got more cycles to go through. It's quicker for those cycles because it's warmer.
Bluetongue 12, a concern?
I mean, all Bluetongue 8 is actually a bigger concern to me than Bluetongue 12, to be absolutely honest. because we know Bluetongue 8 is circulating in France. There is a variant of it which is a little bit more aggressive than the Bluetongue 8 that we had before. I think the fact that it hasn't apparently taken off in the Netherlands, it still looks like Bluetongue 3 is the dominant strain. I'm less worried, but yes, clearly we're worried.
Is there a Bluetongue 12 vaccine, Gordon?
No, there isn't. That's the trouble. So we'd be in exactly the same situation as we were for Bluetongue 3.
Yeah. Okay, look, Gordon, a couple of the inevitable movement questions. I know these are the testers. Okay, and I have to read this carefully. Just to clarify, if you were originally in need of a license to move an animal to a TLA outside of the restricted zone, if the restricted zone has been moved to accommodate the TLA, I can now move these animals on a general license, ?
That's correct. So as long as the TLA is in the zone, no license required. Even if you needed one previously, you can just say you don't need it anymore.
So it's easier in brackets is what the questioner is asking, and the answer to that is
it is, yes.
that's really what they're saying. Okay, so we've done that one. There was another questions about movement. Let me try and find it.
There may have been one about if you're outside the zone and my grazing is inside of the zone, what can I do because I can't get them out again?
Yes, there was one question from somebody who was on the Northamptonshire-Oxfordshire border. I'm sorry, I can't see their question now on the list.
Anyway,
but yes, it was about being surrounded.
So if you're outside of the zone, but you've got tack grazing or you've got rented land within the restricted zone, obviously there is nothing to stop you sending them in. There is no license required to move them in. The question is, how do I get them out again? Obviously, if they're going to slaughter, that's fine. There's a general license to move direct to slaughter. To get them out again, you would need to test them. So there would need to be a pre-movement test and a post-movement test when it gets back to your farm. So it's possible to do that, but there is that extra step to get them back out again. If you needed to, I guess you would maybe bring them back to lambing or something. So it's possible to do, but extra step involved.
There's a couple of points, Gordon, which always come up. RZs are being put in place without consideration the impact on farmers. Well, look, I don't think anybody genuinely believes that that's done deliberately. The restriction zones, in your view, have helped slow the spread this year. That is the scientific analysis. A common one is why not just have a restriction zone over the whole of the country, and not just in those specific areas.
I mean, it's a fair challenge, and it's one of the things that we will need to think about when we get into the seasonal vector low period and when we plan ahead for options for next year. The reason we haven't done it is for the very reason I showed you those density maps. We want to keep it out of those high dense areas until we better understand what it's going to do under UK conditions at the height of the risk period during the summer. The other reason why we haven't just given up is that we do know that there are certain animals that are much higher risk. So we've discussed this before. So we know that maternal transmission is a fact. So animals can be born infected from a dam, that was previously infected. So if that animal moves, even if they could move now, and it could end up in Wales or Scotland or Cornwall or Cheshire, on a dairy herd somewhere, and that gets born, that immediately creates a local risk, and a local risk of midges biting it, and then we've lost it. We also know that entire males, so rams and bulls, can also infect things that they serve, or if you take semen from them, and they, we believe, remain a risk much longer than the 60 days that is relatively safe from midges biting them and then transmitting disease. So as long as that animal is PCR positive, as long as you can detect the viremia or detect evidence of disease, that animal is still a risk, and that could be 4 or 5 months. So if that animal is allowed to freely move outside of there, it increases the risk of overwintering significantly. So once you lift the zone, it's a one-off.
Sort of related to timing issues. Do we have any more idea how long the vaccines are effective for? Trying to think about when vaccination might be the best.
So I think that's where we really are waiting for
Yes.
further dossiers of information. I mean, I think you've got all the information you're likely to have for a decision, in the spring, if you like. It's possible that one or more vaccine companies would, submit a dossier either to the European Medicine Association, whatever authority. They might submit it to VMD, but we won't know unless they tell us that they've submitted it. And
okay, so when we as farmers are thinking about our timings, we haven't yet got that full information to feed that in.
No.
Yeah, I mean,
okay.
Reach out to your veterinary colleagues internationally, because they've obviously got as much, well, sometimes more experience than we have.
Yeah, absolutely. Emergence in the spring from overwintering midges. What are the chances of overwintering midges survival if we do have a mildish winter? Is there anything that we can do in practice on the farm? And would you expect those to, an emergence to actually come earlier in the year because of overwintering midge stocks?
It's certainly a possibility. They can hang out in warm corners of stables and sheds. Midges don't usually survive for months and months, but if they're in a warm corner, it could happen, and then we would see obviously emergence a lot earlier. There are other ways, of course, that it could overwinter. So as Gordon has said, in animals that are currently fetuses that have become infected and are then born in the spring, and also with semen that has been frozen and then used again, but there are restrictions around the freezing of semen, requirements to test bulls or rams before that happens. So there are a few different ways that it could overwinter, and then again blowing over from the continent next spring or summer. I don't know if we have any information on the likelihood.
Last couple of quick questions. Can the official ID for a camelid be a microchip, or is an ear tag required? There's one out of left field.
For the vaccination.
So I think as long as it's an official unique ID, it doesn't have to be an ear tag. It can be a bolus, for example. I'm not sure about a microchip, because I'm not sure if there are official microchips, but I know there obviously are for cats and horses and things like that. I'll take the microchip away because I don't know, but it doesn't have to be an ear tag if it's going to, if you don't want an ear tag for showing purposes and those sorts of things. But so,
okay,
it does need to be readable.
We're coming to the end of our hour. So look, the best question I've saved to last, and thank you very much to Bex Haywood for this one. Does Rudolph need a pre-movement test to help deliver outside of the zone? If so, will this delay Christmas for Wales? Thank you, Bex. Let's hope not. That wouldn't be good for the APHA or DEFRA's PR, would it, if they delayed Christmas? So I'm sure that's not one.
I'm sure Santa has organised his routes so that he goes to Wales and Scotland and the rest of England first,
First.
and
And into the restricted
it goes to the RZ.
Look, Gordon, Clara, thank you very much for your contributions again this evening, and Gordon for all your previous contributions. Now that the weather has cooled down, this will be the last in the update series. However, if there are significant changes over the coming weeks, if there are any circumstances where we feel there's a need for an update, we will stage more updates. I'm hoping that means we don't have to do anything ever again, but certainly until the spring. But if there are circumstances we will do, please keep an eye on the website. Up on the screen are a few other telephone numbers and contact details, websites. There are lots of things going on in agriculture at the moment. This is just another one of the challenges that people have got to deal with. And please, if you do feel you need some help or you need somebody to talk to, any of those organisations on the screen would be very happy to talk with you. So look, thank you again, Gordon and Clara. Thanks for the team behind the scenes for helping tonight's seminar go so smoothly. If it's not too early, wish everybody a happy Christmas. Hope Santa does his job, and let's hope that we see a way through this into next year. Thank you very much, everybody.
Thanks, Mike.
Thank you. Bye.